So you open up the app and there's hundreds of lessons taught by some of the best coaches in the world. And you queue up a lesson that's good for you and your horse. You tack up and press play, and you have someone wonderful in your ear with you for the entirety of your ride, telling you not only kind of the exercises to do, but also providing position reminders and telling you what aids to use, things like that. So that's kind of the foundation of what Ride IQ is. But because we are a platform that's about giving more people access to education, we also do these office hours every week and give our members direct access to Ride IQ coaches and guest experts. So that's what we're doing right now. Like I said, this week's is public. And it would be great if you guys could introduce yourselves or just say hello in the chat and tell us where you're tuning in from. It's fun to see where people are watching from. And this is a very casual hour. So feel free to say whatever you like in the chat during the hour. And always feel free to ask questions in the chat, and Kinsey and I will relay those. So if you have any questions about Ride IQ or office hours, you can start with that and we'll answer them. But in the meantime, I will introduce our guest. Our guest is Ansley Bevan, and she is going to be talking to us about equine massage and bodywork. And we are so grateful to Ansley for being willing to take this hour to cover this topic. It's something that's come up over and over the past year of Ride IQ's existence. And we were kind of waiting for the right expert to tackle the topic with us. And Ansley is definitely that. You might follow her on Instagram. It's how we found her. And she has a very large following. And her platform is all about educating people about how to be the best advocates for their horses and how to promote their horses' well-being. So we couldn't be more excited to take on this topic with Ansley tonight. And Ansley, thank you so much for spending the hour with us.
Thank you so much for having me. This is going to be great. I'm really excited. So my business is AB Equine Therapy. My education is, I have quite a hefty background. I've been a licensed massage therapist in the state of Florida for 10 years. So I got that license initially to work on people. I then transitioned into equine massage. So I've got my certification in equine sports massage. I've also got a certification in equine rehabilitation. And then I have a lot of continuing education courses ranging from nutrition to bit fit and mechanics, pathology, biomechanics of the horse, movement, assessment, pretty much anything you can think of. So pretty vast.
That's amazing. And for anybody watching, I asked Ansley to do that introduction and kind of cover those bases off the bat, because it's a lot. It's a lot of different certifications and a lot of things that she's done continuing education in. So I was like, regardless of how I tackle that, I probably won't be complete or completely accurate. So thank you for going over that, Ansley. And then will you tell us where you're located, and do you have any horses yourself now? Are you riding these days?
Yeah, so I'm in Central Florida, the Orlando area, just a little bit north of Orlando. I do have two horses. I have an off-the-track thoroughbred named Charlie, and I recently acquired a rescue horse, and he is a big Belgian draft horse that I named Sherman. So he was rescued from an auction/kill pen scenario. So it's going to be a lot of work with that one, but I'm glad he's safe, and Charlie and him have really bonded, and they're doing really well together. So it's a learning experience. You're really starting from the ground up. You know, it's Charlie seems very, very tame next to Sherman, because I'm literally starting from the bottom. So
that's so, I mean, Sherman is so lucky to have you, and we have seen him on your Instagram. He's beautiful and seems so happy, but it's kind of interesting that he is the wild man compared to the off-the-track thoroughbred, who in that scenario, usually you'd expect the thoroughbred to be the wild man.
Yeah, I mean, he keeps up. When Charlie has his little moments, I mean, Sherman's right there with him, right next to him. He's just, he really hasn't been handled that much. When I first got him, you couldn't pet him. I mean, you open the stall door, he's kind of cowering in the corner. So I don't think he was treated very nicely. So when I say I've started from the bottom, it's like, we had to work on haltering. We're still working on fly spray, still working on the hose. I can't give him a bath yet. I mean, it's like a lot. So
wow.
It's been interesting. Yeah.
And it's such a big horse to have like dancing around if he's nervous.
It is really interesting too. You don't think about it because me anyways, I'm normally dealing with regular sized horses and maybe ponies, but yeah, a big horse like that is very different. There is a little bit of a nerve wracking fear factor there because it's like, I mean, you cannot physically make that horse do anything. Like you cannot, he's too big. So it's interesting. It really plays into horsemanship and kind of what training route you want to take, because he is this very fragile kind of broken thing. So it's going to be interesting. I'm really excited to see where we are in 6 months to a year.
Totally. Yeah, I'm excited to follow his journey too. All right. So before we jump into questions, which we got a lot of them ahead of time, will you tell us about your business and kind of what your mission is with your business and what your day-to-day looks like at work?
Yeah, so my business started out mostly hands-on therapy, hands-on clients, cupping, kinesiology taping, myofascial release, trigger point therapy, all the hands-on therapies, e-stim, now laser therapy. So I still offer all of those, and I do have my hands-on clients that I work with. But because I have quite a few other aspects of the business now, my hands-on clients are pretty limited. So, I mean, I do clinics, I travel for things like that, but the time that I have allotted for hands-on clients is very limited these days. There are a couple other things I've implemented. I wrote an ebook, so that's my stretching and strengthening ebook, which is really good in terms of, if you're really looking for somewhere to start, somewhere to begin with your horse, and this is all new to you, massage is new, stretching is new, dynamic mobilization exercises are new, you're looking for something new to introduce into your horse's habit or their routine, the ebook is a great place to start. After the ebook, I branched out and I was looking for something that I could give clients that they could use to work on their horses in between treatments or just feel empowered to do something on their own. So that was when I developed the helping hand tool, which is basically a massage tool, works really well with the horse's body, no sharp edges, nothing that you're really going to hurt the horse, and it's more effective than a curry comb. So instead of just suggesting to a client, hey, use your curry comb, bring circulation to the area, now you could take it a step further. Here, buy the helping hand tool, and it comes with a video tutorial. So I show you in the video tutorial how to use the tool and what areas it works really well on. So it's kind of elevating that instead of having, like I said, instead of giving the generic instruction of, hey, just bring circulation, make sure you're currying before you get on or after you ride, or if we've got a horse on stall rest, whatever it is. Now you can really kind of go the next step and invest in this helping hand tool and really take that into your own hands if you want. So along with those two things, I have, like I said, some clinics that I'm doing in the upcoming year. So I'm going to Portugal in February of 2023, which is going to be really cool. I'm very excited about that. And then I also have my remote clients. So there's an option to work with me remotely because as the following has grown, there's a need for people to have expertise on things, and maybe they're in really remote areas. So, I mean, I've got people out in Australia that, they don't have practitioners nearby them. So I'll work with people like that. Also just people that need rehab programs or just advice, problem horses, cases that just can't be solved. And it kind of helps to get another set of eyes on the issue. I'm not saying, that the professionals that have looked at the horses aren't adequate. Of course they are, but, a different perspective sometimes is all it takes. So that's kind of what I do for my remote clientele. That ranges like for what people use me for remotely. But those are all the aspects of the business. I think I covered them all.
That's amazing and super helpful to kind of get our heads around everything that you're doing. I just want to make some notes. So your website is abequinetherapy.com, and your book is there. It's called Equine Stretching and Strengthening. And then the helping hand massage tool is there too, which so your Instagram account is also AB Equine Therapy. For anyone who's not following yet, follow her there. She has 120 some thousand followers. So as we talk about her following, that's kind of what we're referring to. That's just Instagram. So that's one of the channels that you can get all of this stuff and see the videos and the demos that she's doing. But the helping hand tool is really interesting. Like, I've watched your videos on that, and it really does seem like such a helpful way to do what you're trying to do. I actually showed my fiance before he left today. And because he goes to PT all the time and they're using a tool very similar to that on his muscles. And he's like, yeah, you got to have that. And I was like, yeah, it just applies to horses. They're just bigger. All right. Well, that was a super helpful intro. I think we have our heads around who you are, what you do, where you are, a little bit about your horses. So because we have this list of questions, I will hand it over to Kinsey and we can kind of start diving into some tips and suggestions that might be helpful for people who are tuning in today. And again, as you guys are watching, please feel welcome to say hello in the comments, to put your questions in the comments, and Kinsey and I will relay those.
Perfect. Well, Ansley, I'm excited to jump into this because there's a lot of really cool information to cover here. So if we start a little bit like broader and just to kind of throw a question at you, what are some of the primary reasons for equine massage? Like what are some of the primary reasons you would use equine massage?
So to answer that very vaguely, maintenance would be one. So if you have a horse that is a sport horse or performance horse, you want to address something before there's a problem. So maintenance, regular recurring schedule, just like an athletic human. Like if you're an athlete, a marathon runner, and whatever it is, swimmer, you're most likely going to go get massages once a month, once every 3 months, whatever it is, whatever works for your body. Maybe not just massage. Maybe you'll also do acupuncture. Maybe you'll do cupping. Maybe you do K-taping. Maybe you go to PT. It just depends. So I would say maintenance is one of the big ones that I recommend and suggest and would say that that's one of the pillars, one of the main reasons you would do it. Another reason would be if you have a problem. So if you know that your horse has an issue and you're trying to address it, massage therapy might be one of the modalities that you're using. You might also be using laser therapy. You might also be using chiro. It just depends, what your concoction is, how you're going to address the issue. So those would probably be the two main things if you have an injury or just for maintenance. I know there are some people that like to do just for relaxation. If you do have a horse that is a little bit high strung, massage has a lot of the same effects that it has on people. Those translate to horses the same way. So, for a human, if you're thinking, wow, I'm really stressed out, what's going to help me? A massage. So it's the same concept for horses.
Yes, I do think that when I'm stressed, and I also think that if I put like any reasonable amount of effort into my workouts, I'm like, I could really use a massage. So yeah. It does make sense. We have to think about how our horses feel. Is it accurate to say that there are kind of 3 groups of things that somebody could do for their horse? And I'm thinking of those 3 groups as massage, stretching, and dynamic mobilization exercises. And I know there's a lot of things that you as a professional could do beyond that, but are those 3 groups kind of the main 3 that anybody could kind of learn how to have some things they can help their horse with?
Yeah, I would agree with that. I would say that's true. I think there are certain aspects of massage that a regular horse owner or equestrian could provide to their own horses. And I would say the same stretching anybody can learn how to do in a functional, correct way, as same thing with the dynamic mobilization exercises.
So I'm glad you said that, because my next question is, in terms of massage, are there some go-to massages that are great to know for any person with a horse, just to, help them feel better, that you would recommend people getting familiar with and starting to work into their routine?
You mean the owner applying to the horse?
Yeah. So if I asked you, what are a few massages I should try on my horse just to make him feel not because he has a problem, just to be nice and thoughtful to him, and maybe it will help him be looser before we ride. I saw you massaging with the up right above your wrist on a horse's neck, just loosen up their neck. So things like that are basic, but might be helpful for somebody to do on their horse.
Yeah, those type of, I call them user-friendly kind of quick techniques. I have a lot of those in reel formats on my Instagram because they're quick little tutorials that are easy to teach. So I would say some areas that I suggest that are easy for everyone to work on are the neck is a big one, kind of the crest of the neck. There's not as many endangerment sites, so you can be a little bit more vague with what you're doing. I would also say the hind end, so the gluteals, SI region, things like that. Those are also easy areas for a lay person to massage, or to kind of just provide circulation and movement of the tissue. It's a little bit difficult to describe without a visual, but like you said, when you were referencing, this is the base of the palm. This is an easy area to use if you're trying to do some motions, some rubbing on the horse, or, trying to do self-massage. It is hard if you have no baseline, if you don't know where you're starting. But if I was going to recommend to somebody some safe areas that they could kind of experiment or work on, I would say crest of the neck and then the gluteals, because those are larger muscle groups. Like I said, there's not as many delicate areas, sensitive areas, or endangerment sites there. So you would be a little bit safer to start there.
Got it. And if there's any video, any reels from your Instagram that you want me to pull up, I have them here. So we can definitely do that if that is relevant to an answer. So just let me know. And while we're on that, so if you're like a lay person going to try to massage your horse for the first time, and I'm just like wanting to make them feel better, but like also introducing myself to this like new technique, are there risks associated with that? Like, are there things I need to avoid in order to not like go too far, injure my horse? Like, what kind of things, where's the line of like, these are things you should be trying, but also like, don't go beyond this?
Yeah. So in terms of that, you really have to take a step backwards, and we have to focus on pain responses first. Because if you don't know how to recognize a pain response in your horse, then you probably shouldn't try to attempt a massage in the first place, because you're not going to recognize if the horse is unhappy with what you're doing. So pain responses can vary. I mean, you can have the obvious ones, like the horse is trying to kick you, the horse is pinning their ears, the horse is maybe showing their teeth or nipping or grinding their teeth. Those would be very obvious responses that your horse is unhappy, correct? So, but we also have ones that are a little bit more minor. So you might have what we call fasciculation of the muscle tissue, a little spasm, a little twitching of the muscle. If you're applying pressure there, that can be sometimes an indication that there is tension in the area, and you want to be making sure that you're watching your pressure, watching what you're doing there. It can also be if the horse is shifting their weight away from you, so that's something that you want to be really in tune with. It's not just, oh, there's a fly, the horse is moving. No, are they moving away from you physically, from what you're doing? So those are going to be a little bit more muted responses that you want to tune into in terms of, is the horse okay with what I'm doing or not?
What are some do's and don'ts of palpating your horse's body, and where should you be focusing to see if they have these reactions to kind of indicate that there's discomfort there?
So my big do's and don'ts are going to be, you do not use anything sharp. You're not going to use a fingernail. You're not going to use a pen cap. You're not going to use the end of a hoof pick. I know it sounds crazy, but I've seen it done before.
Oh, no.
You're not going to use any of those things. That's my number one rule. The second rule is you're not going to do anything fast, because we all know horses are reactive to quick motions. You never know. I mean, a plastic bag blows by, a leaf blows by, your hand blows by too quickly. I mean, all of these things can incite a reaction that is not organic. It's not related to your pressure, what you're doing when you palpate. So number one, don't use anything sharp. Number two, don't do anything fast. You're going to do it intentionally. You're going to do it slowly. You're going to gauge the reaction. You're going to be very observant with what you're doing. So those would be the big do's or don'ts for palpation.
And is it mostly concentrated like from the withers all the way to the dock, and you're looking like along their spine, or where are you doing it?
That's just one area that you can palpate. That's a big one, because it's going to be a big indicator for back pain. So when I'm talking about it on my reels or my socials, that's typically an area that I show a lot, because it's extremely useful for the everyday horse person to tell, does my horse have back pain? Once you properly learn how to palpate the back, it's extremely useful. So when I'm going from the withers all the way kind of to that SI region, and I'm doing what we call a little like cat paw maneuver almost, you're using the pads of your fingers very lightly, and you're going all the way down. That's kind of that back area. Okay, is my horse back sore? They sore through the lumbar, through the gluteals. That's kind of what you're looking for when you're doing it there. It's not by any means the only place you can do it. It's just a very popular place. You can palpate anywhere on the body. Palpation sometimes is not only meaning, oh, I'm looking for muscle tension. You can also palpate, if you're looking for heat, if you're looking for swelling. It's kind of medical terminology, I guess you would say. Palpation is the art of feeling and observing with your hands, essentially.
Got it. And let's say I go and palpate my horse's back and there is tenderness there. What is your recommendation for like the next steps that I should take?
So this is a big one that nobody wants to hear, but don't ride your horse would be my recommendation. If your horse is back sore, the horse is not magically going to become unback sore without treatment. It's possible that you could give a few days off and that might clear up a bit. But if you know that there's tenderness there and you know that there's discomfort there, my immediate recommendation is do not put the saddle on and go for a ride. Don't do that. I would say you'd want to look into the issue a little bit deeper, get a professional involved. Whether that's a physio, a veterinarian, if you think you need radiographs, I don't know. But that would be the next step, in my opinion. You want to get a professional involved and see what things you need to look at. Has your saddle been checked in a while? Does it need to be reflocked? Does it even fit anymore? I meet a lot of riders and a lot of people that say, oh, this saddle was custom fit, but that was a year ago and their horse is 5. Well, your horse has grown in the last year, right? And even developing muscle tissue. Just because they aren't growing anymore, whether your horse is 10, 12, 15, 18, whatever it is, your body changes just like a person. My metabolism isn't the same as it was when I was 18. You change, your body changes just like the horse. So saddle fit is a big one. I think a lot of people don't realize that how much of an impact saddle fit really does have. So saddle fit, the way the horse is being ridden, is there an anatomical issue there, pathology there, a kissing spine, arthritis, anything like that? It could also be a nutritional element. Is your horse lacking somewhere? Magnesium, vitamin E, is that contributing to the muscle soreness? Is there pathology, PSSM, something that you've never tested for that you don't know? A huge symptom of PSSM is muscle tension. I have friends and riders that I've known who have gone through the book of trying to figure out what was wrong with their horse and why is this horse so tense? Why are they always back sore? Brand new saddle, XYZ, done everything. And it turns out the horse has PSSM. So, the condition is manageable to an extent, but it's kind of like horses are crazy. They're very humbling and you never know what it is. It's the realm of possibilities is endless.
Totally. Is there anything, so other than having a great saddle fitter and checking your saddle regularly and palpating your horse's back regularly to make sure that it's still fitting as they grow, do you like using any sorts of pads or anything like that for a lot of horses to avoid having sore spots from a saddle?
In terms of half pad material, saddle pad material, things like that, I really think that needs to be addressed by your fitter and your horse individually, because I truly think that if you have a great fitter, that person can take care of your problems. They will tell you, hey, you need this specific pad or stay away from this one. I think a common mistake that people do is they buy a pad, they buy the saddle's custom fit, and they throw this big chunky half pad underneath when in reality it's not necessary. You're taking away room, you're taking away wither clearance, you're taking away, you're adding pressure points on the trapezius muscle through the shoulders. It's, oh, well, everyone at the barn is using XYZ and it matches my colors. So, but at the end of the day, it's not about that. And I don't think you know that unless you're educated on it. So, and it's not anyone's fault. As equestrians, we don't know what we don't know till we know it. So.
Exactly. And yeah, everyone is so well-intentioned, but it is really helpful. That's why office hours and talking to you right now is so great, because we're talking to someone who actually knows, who can kind of lead us in the right direction. Okay. I had Kinsey pull up a couple of videos from your Instagram to go back to talking about massages that are just generally great for a lot of horses. So, Kins, if you pull up one for the neck loosening, maybe we can talk about this. Yeah. So this is the one that I was referencing. Can you talk about for anybody watching and anybody who's just listening, there's a link in the episode description so you can watch the video as well. And it's on ABE Equine Therapy on Instagram. But can you just tell us what's happening here and how much pressure you're using? Any tips about doing this neck warm-up massage?
Yeah. So the first tip is going to be, you can see in the video that I'm focusing on what we call the crest of the neck. So that's going to be the part directly, the meaty part of the neck directly under the mane. That is going to be the crest of the neck. And the reason we're focusing there versus lower towards the esophagus is because when you do go lower, you have on the lateral portion of the neck, you have the cervical vertebrae. So there is a bony area there, and you just want to be delicate. So that's why in this video we are focusing above that. So, which is one of the reasons that I showed this one, because it's very user friendly, and I describe in the caption where you should be doing it. So you're in the safe zone. You're not going to be messing it up. So in this zone, we are focusing on those cervical muscles. So you've got the rhomboids, the cervical trapezius, you've got the splenius. So these are all muscles that we're helping to warm up, whether it's pre or post ride, or your horse is on stall rest, or you're just grooming and you feel like, bringing some circulation and giving them a little work. You can do it anytime. There's no, set time. Like, it doesn't have to be done before you ride. It doesn't have to be done after you ride. You can literally do it whenever. So that's kind of what that video is showing. It's basically just an easy way that you can work on the cervical musculature, and you can hit a couple different muscles in one go, just by using the base of your palm and working your way from the withers up all the way towards the pole. So, and I would say the neck is, that's a big area. The horse, as we know, in work, they're constantly using their neck. They're constantly using their forehand musculature, thoracic sling, all of that. So the neck is a big one. I think that's a really good area to focus on and to do these little tips and tricks.
Amazing. And is that a good one for before you ride, after you ride, or either?
The previous video? The previous video,
yep.
Yeah, I would say maybe if you're going to choose one, maybe do it after, because your horse has just done, a nice workout. And especially if you have a horse you're working on a lot of collection or anything like that, working out the neck is going to be great for them, because they're using all of those muscles along the dorsal line when they're in collection. So.
Okay, great. And then Kinsey just pulled up this main grab. I kept saying main pull, I think, just because I say that sometimes.
Yeah.
So yeah, main grab massage video. I don't know if you would consider this a massage, but is this also one of those things that would kind of fall in that category of easy things that you can do to make your horse feel better?
Yeah. So once again, this is really user friendly, really easy. If you're doing it correctly, you're not going to hurt the horse. You're using a gentle pressure, and you're basically just intertwining your fingers into the mane, and you're doing a little bit of traction. And I think I state in the description here that the video is sped up, so it may not look as gentle as it is in real time. In real time, it's a very gentle motion, and you're just working your way up and working your way back down. And basically what you're doing here is you're just mobilizing that tissue and just helping to loosen everything up. So this is not going to be a technique that's necessarily bringing more circulation. That would be more of the previous video. In this one, we're more focusing on mobilizing and breaking things up. It's going to be really good, once again, for those rhomboids, nuchal ligament, and just creating movement and mobilization through the crest of the neck. Okay,
great. And then any other things that we should have in our toolbox for neck massages before I move to the hind end and show some videos there?
I'm trying to think if I have any others on my Instagram. Those two were probably the main ones, some easy things that the lay person can do.
That's perfect. So just basically interrupt me as I go if I'm missing things that you think we should add in. But now we have a video of you using the helping hand tool on the hind end. And this is a butt tuck video, actually, booty tuck. So is this something that would be helpful for a lot of people, or is it more like, is it more to treat something?
No, this is helpful for everyone. I will say, disclaimering, if your horse has an injury or for some reason has not been cleared by a veterinarian to do this, like if you have a neurological horse or something like that, you want to make sure that it's been cleared by a vet prior. So I shouldn't just give the disclaimer that it's okay for everyone. But typically, this is going to be an activation exercise. So you're activating those pelvic stabilizer muscles, you're engaging the core. This is really good for the horses, especially since you're targeting a different area than maybe what we call a belly lift or an abdominal lift. So I do like the butt tuck. In this video, I'm showing how I like to do it versus how I don't like to do it. I think it's in the first clip, you'll see me running my fingers quickly down the butt, and you'll see very jerky motions from the horse. You can see in that hip area, you see them kind of jerk once and jerk twice. As you can see, as I go all the way down the hamstrings. I do not recommend doing it this way. This is not a very intentional way of the horse engaging that musculature. If you think of when you go and work out, whether you do, let's use a core exercise or like a bicep curl or something. If you're just going really quickly like this, you're not doing an intentional movement, intentional activation and engagement of that musculature. Everybody knows if you're lifting or you're doing weights or something, you're doing a slow, controlled, intentional movement. And that is how you engage the musculature correctly. So for the butt tuck, there's a reason that I don't like to run my fingers quickly, because you're enticing more of almost a ticklish or neurological response. It's a reflex. Of course, the horse is going to tuck their butt very quickly and try to get away from that motion, whereas if you're doing, sorry, I'm backwards on camera. When you're using your fingertips and you're kind of digging in, not your fingernails, not something sharp, but just the pads of your fingers, and you're kind of doing like this little kind of rub, gentle scratch, like, hey, engage those muscles, tuck the butt under. That's a more intentional way of doing it. So that's what I'm showing in the video, is how I like to do it versus how I don't like to do it. So, and that's another one of those that you'll see sometimes people will take like a pen or the end of a hoof pick and they'll go all the way down. And I'm just like, why are we doing it this way? So I don't recommend doing it that way. Nothing sharp.
Got it. Yeah, that makes a lot of sense.
Yeah.
So am I getting feedback? Is it good? No? Okay. So that was really helpful. One question we just got in chat is, how can you tell if your equine therapy is working? She says, I can see the therapists get excited when they see the horse licking, chewing, and yawning, but is there any research that backs up regular massages?
Yeah, so the licking and chewing and yawning is what we call in the biz, those are releases. So these are responses that research has showed us that the horse is having a release. It's almost like, it's not the same as a human yawning, because that would mean, oh, we're sleepy, but it's like they're letting tension go. So in general, the generic term we use for that is a release. So, and there is research that has shown that these are positive responses when the horse is having reactions to the fascial work, the muscle work, the lymphatic work, whatever it is that you're doing. So these are good responses. So that would be why your therapist or your chiropractor or whomever it is, when they see those things, licking, chewing, yawning, those are the three big ones when it comes to your horse having a release when you're having these therapies done. I would say, though, on top of that, when they're asking how can you tell if equine therapy is working, in real time, that's a different answer versus under saddle or whatever you're trying to address. Like, there are horses that are very guarded that you might not see them experience any releases in real time, but that doesn't mean that the therapy isn't having an effect. I would say if you're not noticing a difference under saddle, or if you're not noticing a difference in your problem, if you had a problem and that's why you're getting the therapy done in the first place, then you should probably readdress it. I mean, maybe your horse is more responsive to a different type of therapy. Maybe you need a different practitioner. It's not just about the horse experiencing releases.
That makes sense. I think when you were talking about like what the equivalent might be for a human, I was like, a big sigh is how I feel like when the stress goes away, I'm like, I audibly sigh and I'm like, I probably should keep that to myself.
Yeah, that's a good one. You're right.
Somebody in chat just said your dog is adorable.
Yeah,
he is being very well behaved. All right. So At what point would you recommend, if somebody has the resources to do so, a person having a regular massage practice for their horse? Like, is it at a certain level of work, a certain age of horse? Not for problems that are happening, but just if the horse meets these things, it would be great for them to be seeing an equine masseuse regularly. What are the horses that fit into that category?
Did you say you were basing this on age or not?
Yeah. So age, I didn't know if that was one of them or if just like their amount of work was one of them. I was just starting to guess what your answer might be.
So I have a couple different categories for this. I have the category of performance horses. So if you're an eventer or a show jumper or a barrel racer, whatever it is, and you are competing regularly, as a baseline, I say those horses should get work done or should see a practitioner once a month. And this is a horse that's in, high levels of work. They're competing at a higher level. I mean, minimum once a month. And like we talked about in the beginning of the chat, that's going to be for maintenance. So a lot of times massage therapy is preventative care. So we're reading the muscle tissue, we're reading the patterns, and by working on the horse regularly, we can tell, hey, there's a problem here. We've got a lot of buildup in the left shoulder. This is abnormal. This is a recurring tensional pattern, and we can catch something before it becomes a bigger problem. Maybe that tension is there because you've got desmitis in the suspensory ligament on the left side. So, that would be maintenance and preventative care category for if you've got a performance horse or something like that. The other category would be if you have a horse with pathologies. So if you've got a horse that has PSSM, if you've got a horse that has a very arthritic hip or hock or something like that, they have a gait abnormality, so they tend to hold tension at XYZ. Those are horses that are in, I would say, a pathology category. So that would be, I would say it really depends on the ailment to decide what that schedule would have to be. Does that horse need to be seen biweekly? Can they be seen once every other month? It just depends how they maintain what their comfort level is with whatever anatomical issue that they're dealing with. I would say the other category would be, let's just call this one for like our pasture ponies, our old retired guys, or just our horses that don't have a job, but we just want to give them a little spoiling. That can be done whenever you want. There's no, maybe they don't ever need it because they really don't have a job and they maintain well, but that's just a personal preference. So I would say those are the three main categories of kind of how you would determine how often to get your horse treated or what kind of schedule to put them on.
And on the same kind of vein, as a rider or horse owner, how do you decide, like, if I'm going to do one of these like maintenance things for my horses, hire one person, how do I know if I should like do a chiropractor, a masseuse? What kind of, like, how do you know which therapist you should be hiring? And then, not to give you two questions at once, but like, what kind of things should you be asking that therapist to make sure they're qualified and like actually the right person for your horse?
Okay. You might have to remind me of the second one if I derail, but I'll try to remember both. So the first question you asked was, how do I choose? Like, how do I choose who I want to use? So I probably have an answer to that that's maybe not a popular opinion, but I'll say it anyways. I prefer massage therapy over chiropractic as a first line of defense because I feel like it's less invasive, and I'm a little bit more of a homeopathic person when it comes to that. I'd rather do less before I have to do more. I also think that people rely on chiropractic as a crutch. I feel a lot of times they use it too much, and over mobilization of a joint is not great. So, and thirdly, my third aspect to that is, if you think about what happens in a chiropractic scenario in terms of, we have a misalignment or a subluxation or something like that, muscles are a direct component, a direct contributing factor to that. So if you're only ever getting chiropractic work done, but you're never doing anything to address the muscle tension and the fascial tension, you're never going to not need chiropractic. You get what I'm saying? Those muscles and that fascia and that tension is what is a contributing factor to that. You know what I mean? I don't know if I described that well enough.
You did.
But so, and because being a licensed massage therapist for humans, spending 10 years in that field as well, it was the same thing. So I've worked in many medical facilities. I've worked very closely with chiropractors, and it's the same thing. There's a reason that human chiropractic facilities most often will also have a massage therapist that works there, and they will also prescribe that. Hey, I want you to come in and get a massage before we do your adjustment, because the two therapies go hand in hand. So if you're out here and you're getting your horse adjusted every 4 weeks and you're not doing anything else, I would reanalyze the structure of that schedule. But that's just my personal opinion. I don't remember what the second thing was I was supposed to be answering.
It was basically just like, what kind of questions would you ask a massage therapist or a chiropractor or anyone to make sure they're qualified and like you want them working on your horse?
Oh, I was also going to add to the first thing, because I know it's not just between chiro and massage. There are other modalities as well, right? So you've got acupuncture, you have, let's say we've got the PEMF therapy, which is really popular now. We have laser therapy, things like that. So it does depend on what your horse's issue is. Is it something that requires injections? Is it something that requires massage? Is it something that requires chiro? So it depends on what the horse's issue is. But B, a lot of times these therapies are complementary. So it's not just one thing that you should be using. If you're using MagnaWave religiously or Beamer or whatever it is, PEMF therapy, but that's your only form of therapy, I would modality, but I do not think it's the only thing that you should be using. Anyways, and then to jump to the second thing, you were saying, what kinds of questions should I be asking? I think education is a big one. What is this person's background? What is their education? Did they get a certification online and then, now they're out there in the field? I mean, I don't know. There's a lot to unpack there. I think online courses tend to be a little bit difficult because, how much hands-on experience do you really have? What other continuing education has there been? Were there case studies? How many hands-on hours? Sometimes that can be a little bit thorough, but it just depends how much you're trying to vet this person. My other thing would be, a lot of people, word of mouth is a good one. So if you have horses that are performing well, and that are not in pain, they're not uncomfortable, and they're not constantly breaking down every 6 weeks, and those horses are all using the same practitioner, that's probably a good indication that that practitioner is doing a good job. So that would be one thing to look at. I had another thought, but I forgot it. In terms of looking for a therapist, I think too, a lot of times you should look at their process. So are they coming into the barn and just treating without asking any questions? Are they just doing their same run-of-the-mill routine on every single horse? Because if they are, personally, I don't think that that's great. I mean, when I go and I look at a horse, especially if it's the first time I've seen a horse, I'm lunging that horse. I'm looking at the horse's saddle. I'm looking at the horse's feet. I'm asking what kind of bit they use. I'm asking how many times a week they're ridden. I might even watch them go under saddle. I mean, at first, it just depends, because a lot of times you can get to the bottom of things just from observation. So without me even having to put my hands on the horse, I've already gone through 7 other things that now I can add to my toolbox and be like, okay, well, that fits because I also felt this, this, and this. And then it also allows you to come up with a more thorough and effective treatment plan if you know all these other things. I mean, I've had numerous horses that I've worked on, and I'm sitting here thinking, okay, well, we've got to address this left front foot. We've got to address the saddle pad you're using. We've got to address, when was last time your horse got their teeth done? And so you'd be surprised how much goes with it. So if you have a therapist or any practitioner that's just coming into the barn and they are not asking you any questions, they're really kind of just superficial about things, that would, to me, might be an indication that you want to get someone a little bit more thorough who knows their stuff and is really good at observation and wants to be part of the team,
I feel like everybody watching or listening right now is like, wants you to go work on their horse. Is probably like, man, I really wish that this was just my person. But these are all really helpful tips, and it's really helpful to hear what your expectations should be for an appointment, because if you haven't done these sorts of appointments before and you don't know the norm, you just don't know what you don't know. We have a question in chat from Krista. She said, is myofascial the right way to say it?
Yeah.
So she said, I get myofascial release done for Stella, who's her beautiful bay mare. And she said, She also gets chiropractic work done for her, but she asked, is myofascial different from massage therapy? And if not, she said, which is best? So maybe you'll have, Krista's here. So if you have questions for Krista about Stella, you can ask those.
So that's an interesting question. So a lot of times people will use myofascial work and massage therapy interchangeably. Coming from the human side of things, myofascial work is a very different modality than a regular sports massage or Swedish massage or deep tissue massage. So when it translates to horses, I will have to say myofascial work and massage therapy are interchangeably used often. I see very rarely in the field a therapist, an equine therapist, truly doing myofascial work. More often than not, it's a blend. You're having myofascial work and massage therapy done at the same time, or kind of interchangeable modalities. But I don't know that I would say one is better than the other. They're both very effective, especially if you're doing a blend of the two. I mean, a lot of times in my work, I'll do a lot of trigger point therapy mixed in with what I do. So it just depends. Certain therapists are better at certain things, and certain horses respond better to certain things. So some horses I work on, they want more of a myofascial work that's a little bit more calm, a little bit more still, slow, lighter. I get other horses that are really responsive to trigger point work, which is a little bit more along the lines of like an acupressure or something like that. So it just depends.
Got it. Okay, so Alice is here as well, and she is asking if you have any advice regarding a horse recovering from EPM.
Horses recovering from EPM, I mean, it's a tricky one because it depends, what was their initial prognosis? How bad was it? What are their expectations recovery wise? I think massage is great because, you're providing circulation. It's a healing modality. For EPM, since it is neurologic, I would actually maybe go the route of something that has more of an effect on proprioception and neurologic, like a neurological standpoint. So maybe kinesiology taping might be a good one to kind of wake up those limbs that were affected and really bring proprioception back into the picture and wake those things up. I mean, like I said, it's hard to answer vaguely without knowing the details of the situation, but by no means is massage going to hurt the situation.
Okay, great. And Alice, if you want to add anything, we can always go back to that question too. In the meantime, I want to talk about stretching, similar to how we talked about massage. So for horses that are in, like moderate work, not, just like your average horse who's working, are there some stretches that you really like to do for your horse, either before or after you ride?
I think that foreleg stretches and hind leg stretches are always beneficial. I mean, once again, I say that with the disclaimer of, your horse not having a fracture or being in a dangerous situation because they're neurological or they, have severe arthritis or things like that, like an average horse that's in work, that's okay. I, of course, think that foreleg stretching and hind leg stretching are beneficial. You see your horse do this on their own, in their stalls, and they walk out of their stalls in the morning, or, if they're feeling good on the cross ties, you'll see that happen regularly. So that's a pretty good indicator that those are safe things to do. You asked about mobilization exercises as well, which is that way. I forgot the second part of the question.
Well, there actually wasn't a second part. I was just curious. So for stretching, you said foreleg and hind leg. So Kinsey just showed a video there. And that video, if I remember correctly, you were suggesting that when you do a foreleg stretch, you put your hands behind the knee in the fetlock. And then how hard are you pulling out on those legs? How long are you holding the stretch for your horse?
So I always recommend starting small. So I recommend, don't dive right in and try to hold the leg for 30 seconds. Maybe 10 to 15 seconds, and then you can always go back and do it again. You don't have to hold it so long the first time until, where your stopping point is the horse pulling the leg away from you. Let's not do that. Let's stop the stretch before that happens. I recommend that hand placement because it's, in my opinion, safer for you and safer for the horse. You have more control over the limb. You have more control over the leg. That foreleg the previous video that we were talking about. So that's why in that video I was showing that hand placement. Like I said, you can do it repeatedly. You can go back and do it a few times. You don't have to just do one hold and then you're done. So, and then this video here is showing a little bit of a hind leg stretch. And that's how I like to do this hind leg stretch. I kind of tuck the knee in front of the hock there, and I extend backwards, extend the hind leg backwards. The key about this one is you want to make sure that the horse has relaxed the leg. You can see when I pick it up initially, it's kind of hiked up a little higher. So I hold it a second. I know the video is sped up. It's hard to see. I hold it for a second before I tuck my knee under, and then I relax again before I extend back. So
and you extend. Are you extending with, so the horse's hock is, or the front of the horse's hock is kind of resting on your knee, and then you extend the leg back with your hand?
So my, I guess it would be my left hand is on the medial side of the leg. So it's inside the leg, just holding, resting, supporting. My leg is what's pushing the leg back. So you see, I'm kind of shifting my weight back, like I'm kind of squiggling that left leg out, like I'm scooching over. So my leg is what's holding the leg back. And I also like to do it this way versus getting really handsy, because this way your head is not down there by the hind legs. You're not in the strike zone with your head or your hands. I mean, you see a lot of people going down there and really manhandling the leg. I think this is just a safer way to do it, which is why I broadcast this on my socials, because it's a little bit more user-friendly, beginner-friendly. It's just safer, in my opinion.
Awesome. Yeah, that's really helpful. That's one thing is, like, I've always known how to do, like, kind of how to do the front leg stretches, but I've always been too afraid to even, like, embark on the hind leg stretches, but that's a really helpful visual. To that end, one thing that I've like thought was fun, and I don't know if it was like helpful to get your insight on, is if you like take a carrot and put it between the horse's legs and get them to stretch their neck down. Like, is that useful or mostly just silly?
It is useful. There are a couple points that go along with that. It kind of depends how far the horse is reaching. If they're scooching back while they're doing it, if they have a leg very bent, like they're going to do a bow or not, all of those factors come into play, which dictate which muscles the horse is activating. So when you do a four-leg stretch, or I'm sorry, let's say like a carriage stretch or a baited mobilization, where the nose is coming all the way down and you're kind of coming in between those, let's just say, not at the knees, we'll say the front fetlocks, if they're coming all the way down and going through, in reality, what we're looking for is a lift. We're looking for a lift through the belly. So engaging those abdominals, they're going to be engaging those quadriceps. They're going to be engaging those pelvic stabilizers as well. They're also going to be engaging the neck. So I really like that one, because you've got, and I also think there's a picture on my Instagram where you can really see the muscles. I pointed out like 5 different sections. It's pretty old. I don't know if you can find it. But the lighting was really good. So you can see all these muscle groups that are engaged as you're doing a simple baited mobilization of a nose through the the 4 legs.
There's that picture.
That's the one. Yeah, but you can see in that photo, like I'm pointing at, not the star, but everything else that I'm pointing at, all those muscles that are engaged. Like, look at this through the neck. Look at that abdominal line. I mean, look at those hamstrings. Look at that quadricep. I mean, these muscles are just from that simple, and you can see we've even got a bent knee, which is okay. I mean, he's not going all the way down into a bow, but I mean, we've got a lot of muscles that are engaged there. It's extremely useful, extremely beneficial. I mean, this is a really great exercise to do with your horses.
That's awesome.
This horse is gorgeous. Just as a note.
Is this your thoroughbred?
Yeah, that's Charlie.
Oh, yes, he's beautiful. All right. I just keep getting off on my own questions because I'm curious, but we have a couple of questions in chat that we'll make sure to answer. So this first one is, what's the best way to loosen up a tight lumbar area? And then there's some context here. She said, with chiro and massage, my horse still holds a lot of tension in his lumbars. If there's any time where he's out of his massage or chiro routine, he'll get a noticeable raised spine in that area. I honestly think this is because of tight muscles more than the spine being misaligned.
Okay. If I was treating this as a client or a new person, my initial questions would be, how much work is the horse in, ridden work or not ridden work? how often are those chiro sessions and those massage sessions? I'd want to know the horse's routine. That's what I would ask. First, I might ask dietary, try to make sure, there's nothing missing that's going to contribute to muscle tension. Is she asking what the best type of massage is or what she can do in between?
I think she's asking if there's anything she can do to help loosen up that tight lumbar area, given that she's already having chiro and massage done.
Yeah. So my suggestions for that would be she should learn some massage techniques herself. I would recommend taking a class, investing in something like the helping hand tool, or, really just doing a lot of currying in that area before and after you ride, or daily as part of your daily grooming routine. Because when you're currying, even though you may not think about it like this, you are bringing circulation to the tissue. So you're warming it up. It's like if I sat here and rubbed my arm, for like 5 minutes or 2 minutes or whatever it is, I'm going to have a warm arm. There's circulation, there's blood flow. So that's going to help. And that's the basis of massage therapy. So even though you don't know what you're doing, or you don't know these official massage techniques, if you're currying or if you're using the base of the palm and just kind of rubbing that area, if you know exactly where it is, it's localized, and you feel comfortable doing it, you don't have to use a ton of pressure. I mean, if you know your horse, you can read your horse's reaction, just make sure they're not giving you any pain responses, then that would be my main recommendation. Just go in there and do some of that manual work yourself if you know where the problem area is and you feel comfortable.
Yeah, totally. Krista, different person, is now saying that her horse hates currying. Okay, sorry. The chat is just very active right now, so I'm getting distracted by it.
So I hear that often, though, that there are horses that, don't really like currying, and that's okay. I mean, if it's an extreme response, like my horse doesn't like to be touched, to me, that is an indication that there's something else going on. Do you have an ulcery horse? Do you have a horse that, needs to work through some things? Do you have a horse that needs to go back a couple steps training and you need to positively reinforce some stuff? I mean, that's one way to look at it. But if you have a horse that is just averse to a curry because maybe it's not as soft as they like, that's, something else.
And one comment I'll add, since we are coming up on the hour, we have just one more serious question for you, and then a fun question to end on, is that you do like an hour-long support. You offer an hour-long support call. Is that right? Like if people need, yeah. So for anybody who's listening, whether you're here in the chat or if you're listening after the fact, and you want some specific things to be recommended for your specific horse, I think that seems like a really cool opportunity. So I just wanted to mention that because it's kind of like, this is an example, that question. I'm sure there would be a lot more that you could chat about, knowing more about the horse. And I know there's things coming in chat about the horse too. It's just a limited time.
Yeah. Well, and that's part of the reason that I made that, was not just for, the people that are remote or may not have access to practitioners, but, there are people, I get people in my DMs all the time. Hey, can you look at these pictures? What can you recommend to me? So I had to make the option. So that's pretty much how it is. It's a call with me, but we're also going to be looking at things. We're going to be looking at radiographs. We'll look at body conformation. Maybe we'll look at videos under saddle, and I can kind of give you my input, what I think, and give you recommendations. If a treatment plan is applicable, then we'll do that. So the call is very flexible. I mean, everybody's got different issues. It just depends kind of what you're wanting to focus on.
Got it. That's good to know.
Sounds like such an awesome opportunity. That's really great. So one thing you've mentioned a couple of times throughout this hour is how you recommend talking to a saddle fitter, making sure that you're covering all the bases. One question we got is, what do you also think about bridle fitting, bit fitting? Is that something that you also think is a really important part of someone's routine?
Yes. So bridle fit it's an interesting, okay. So bridle fit, yes, is important. You should absolutely make sure that the bridle fits the anatomy of your horse's facial structure. So just because you have a, bull-tail saddle and you want the bull-tail bridle because it matches and, everybody else in the barn is sponsored and that's what you want, or CWD or Devaku or whoever, it could be whatever brand. I'm not trying to hate on any specific brand. It could be whichever. It doesn't mean that bridle is the best fit for your horse. It just doesn't. I mean, their anatomy is different, just like ours. That's my number one thing. You do want to make sure that it fits your horse anatomically. You want to make sure it's not hitting any bony landmarks on the face, or, if your horse, you can see horses have different ear sizes. Do they need a cutback, band for the pole? What do they need? So I think a bridle fit is a big one. Bit fit, it should fit correctly, but bitting in general, I mean, I fell into the routine of using the bit that the trainer suggested, because that, everybody has a favorite bit that they like, is very effective and that everybody uses, or, they have their kind of 3 or 4 that they love. So I kind of fell into that routine. And before I experimented for myself, it was like, I was always using the same 3 or 4 bits. So I mean, I actually ride bitless now because that works better for my horse. But I think those are all things to take into consideration. Like, you really do have to think outside the box. If you have an issue with collection, or, a horse really being unable to relax, is it coming from the mouth? Is it coming from the bit? Is it coming from the teeth? Is it coming from TMJ? Is it actually coming from the back? I mean, it's not always localized. You really have to be in the realm of, this is my checklist of 50 things, and have I gone down the list and checked all 50 things? So kind of derailed there from your question, but yes, I do think that bit fit and bridle fit are very important. So yeah.
No, it's great advice. And I mean, sorry for the feedback. Kinsey and I are not sure why that's happening tonight. It's great advice. And it's a great reminder that, one size doesn't fit all. You mentioned a couple of times that if everyone in the barn is wearing it, that doesn't mean that that's the one to get necessarily, but it just really is a constant journey of experimenting how to make your horse happiest and most comfortable. Because there's a lot, like there's so many bridles to try and so many bits to try. But when you land on one that works, it's pretty exciting.
Yeah. Well, and a good example is, I had a Voltaire saddle, and I went and bought the leather girth because I'm like, oh my God, it's so beautiful. I need it. It's going to match. And this girth, it was only the left shoulder, my horse's left shoulder, rubbed it raw. Like, and I'm like, what is going on? Does it need to break in? What is it? I mean, that girth just it wasn't going to fit my horse. It wasn't that it was the wrong size. It wasn't that it was too hard. It wasn't anything. It was just his anatomy is different. I mean, he's got some issues in general anatomically, but that's just one small example of how something that maybe fits everybody else is not going to fit your horse. I mean, it's just nothing, there's no workaround there. You just got to find something else.
Absolutely. And I'm realizing it's like winter now because it's 7 p.m. and it is so dark in my apartment. So I apologize if I got up and whatever. I'm sorry, it's so dark behind me. Okay, so last question is, what is your favorite part about your job?
I would say I'm a problem solver, I think, at heart, which maybe I didn't realize that when I was younger, but I really, I find that it's extremely stimulating for me brain-wise to kind of like be very investigative with things and solve problems. And I really love, seeing a horse go from, like from here to here and being a part of that. So, I mean, I love seeing their responses. I love making them feel better, but I think the icing on the cake for me is when I can take a horse that was, in pain, not moving well, not doing things well, and I can make a couple critiques or suggestions, do some hands-on work, and then we've got a totally different animal at the end of the day. And we've really implemented some changes that maybe wouldn't have happened otherwise. So that would probably be, I would say, the best part.
That's amazing. Your enthusiasm for all of this just comes through so loud and clear. And I feel energized after talking to you because of that. So thank you. And thank you for everything that you have shared with us over the past hour. We will put a bunch of resources in the show notes. So people who go back and watch or listen to this will have those reels that we took a look at. They'll have your website and all the things that we mentioned. So hopefully people will be able to find you and continue learning on this subject. But we appreciate you so much. And it's been so fun getting to know you better during the past hour. And just thank you for Kinsey and I cold called you and asked if you wanted to do this. So thank you for responding. I know you're really busy. I know you're in a location right now where the weather's a little bit dicey, like a lot of people are. So we really appreciate it.
I keep looking outside. There's no rain yet, so I guess we're okay. But I guess we'll see. But I did want to say, though, I also do offer, I actually just released it in September. It's a foundational equine massage course, which is geared towards owners so they can be empowered and learn the skills and the tools to help their own horses. So I think a lot of the things we went over today are in the course. So if anybody's interest was piqued with any of those conversational topics, that might be something that would be worth checking out. But thank you so much for having me. Definitely,
yes. And that's a good reminder about the course. We'll link that as well. But anybody who's listening, you can tell, like, there's just so much commitment to education and horsemanship. And, we're all about that too. So it felt like a great fit, and it was a great fit. So yes, thank you. And I'll just leave on one note that I normally don't do, but since we have people here who might not have been to office hours before or came in late or whatever it is, these office hours are something that we do as part of the Ride IQ membership every single week. And this was one. Some of our recent ones have been with like a US team vet, a top farrier, a top dressage judge, an equine nutritionist. Like, we cover tons of fascinating topics with fascinating people. So if you're interested, all of those are recorded. There's 58 of them now, and they're on the Ride IQ app. So you can go back and dig into that, and everyone gets 2 weeks free. So you can look up Ride IQ in the App Store or get more information on our website, which is ride-iq.com. I feel like I'm in a commercial, but I have to tell you guys. And you can find more about like what Ride IQ is in addition to office hours there too. And Kinsey and I are on social, happy to answer questions. So with that, have a wonderful rest of your evening, everyone. And thank you again, Ansley, for joining us. We appreciate it so much.
Thank you so much for having me.
Bye, everyone.
Thank you, Ansley. Bye, everyone.